Senior transportation is probably 50% of the problem if you're aging in place. As my wife says, I don't know what I'd do if I couldn't drive anymore. Howard County spends some $11 million on transportation. It's not a small amount of money. However, the issue for seniors as they get older is door-to-door transportation, getting the medical services, doing their shopping, and that becomes a real issue. The first panelist is Virginia Dize. She's from the National Center on Senior Transportation.
Okay, good afternoon, everybody. Thank you. I'm very pleased to be here. I'm going to just signal you to move the slides along, okay? So, go to the next slide. I am with the National Center on Senior Transportation, have been with that center since 2005, and 2008, for 5 years. And the center is a partnership between Easter Seals and the National Association of Area Agencies on Aging, which is where I work. And it is a center that is dedicated to the notion of increasing transportation options for older adults in this country, wherever they live. And a lot of our work is spent working one-on-one with communities. We have done 3 rounds of grant making, very small, modest grant making. And we are probably going to be doing another small round of grant making in the next few months. But obviously that's the tip of the iceberg. Next slide, please. So why is senior transportation important? I think it's very important to remember that older people increasingly are traveling. Even though as people get old, they tend to travel less, but because of the huge numbers of older adults, the number of older adults who are traveling is increasing. Older men tend to be more mobile than older women. In part, this is because they hold on to their car keys more tenaciously in general. But that also is changing, and I think that's a change that we will really see with the baby boom generation. At N4A, which is a membership association whose members include all the area agencies on aging around the country, we run the Elder Care Locator. Are folks in the room familiar with the Elder Care Locator? It's a nationwide toll-free number, and there are handouts out at the registration desk that include a bookmark that talks about both the Elder Care Locator and the National Center on Senior Transportation. We have a special relationship in part because with the over 200,000 calls that the Elder Care Locator handled last year from older adults and caregivers, the number one reason people called was transportation, not financial, not insurance, transportation. And a lot of those people who called were folks who called because they needed a ride, they needed a medical ride, they didn't know where to even start in their communities to find out about how they could get assistance. They may have had other arrangements up to now, but suddenly they were in a crisis. And so we connect them directly with the local agency where hopefully they are helped to make whatever arrangements are possible. Next slide. We know that giving up the keys has a profound impact, and the impact is not just emotional. It impacts the ability of older non-drivers to get to the doctor, but also it impacts their ability to do things like grocery shopping and things that are basic to people's basic survival in the community if they need to connect with local services. It also does have an emotional and social impact in that it does lessen older adults' ability to connect with family and friends, with church, with synagogue, with all those things that make their lives worth living. And it also impacts caregivers because we know that a lot of caregivers take time off from work. I work in a profession and at a place where if I need to take the day off, take my mom to the doctor, nobody raises an eyebrow. Everybody is fine with it. There are people, as we all know, who cannot take the day off work because they risk losing their jobs to take mom or dad to the doctor. And transportation, without access to the community, it does have an impact on people's health care, on their general health and their general emotional health, and it can, in fact, lead to institutional placement, which, guess what, costs a lot more than living in the community. Next slide. Now, we've had mentioned the whole notion of walkable communities. I'm really thrilled to know that folks have mentioned that, because transportation should not be thought of as just a bus or just a ride. Mobility is really what we should be talking about, and how are older adults going to connect with the community. And you start on your feet. You start with walking. Are your neighborhoods walkable? Can you access essential services pretty easily? Do you always have to get in a car to get back and forth? If you are driving, and let's face it, the number of older people is increasing. We can't have everybody 65 and older to give up their keys and depend on public transportation. Why not? Because we don't have the resources to transport everybody. We really need people, to the extent possible, to stay active on the road, able to drive, and we need to support older adults and help them brush up on their riding skills. But there are also things we can do with the roadways and signage and things like that to make it easier for older adults to ride. And it's very important, as I frame all this, to say one size does not fit all. What works in Howard County is not necessarily what works in Montgomery County, or works in the district, or works in Alexandria in Virginia. Every community has its own set of characteristics and strengths, as well as needs. And so we need to look at the whole community-based picture. Next slide. So I think about transportation for older adults as a family of transportation options. These are samples of the kinds of things that a community can have in place. It's rare for a community to have every one of these things. It really depends on the community resources and also the characteristics of the community, because if you live in a rural area, chances are you don't have any of these. Next slide. So with the next slide, I'm breaking down these options. And think about transportation in kind of three ways. If a community can only have a few options, what are they? Transit is certainly a big one. And older adults who don't use transit, and many older adults have never used transit in their lives, so helping them be able to use transit and feel comfortable with it is an important part of this picture. That's travel training down there in the blue. There are also things like, if you think about senior transportation beyond transit, the most common service that has been developed is volunteer transportation. Those are not all alike, and I'm going to talk about those a little bit in just a minute. Then there are lots of additions, creative community solutions. And what's a creative community solution for you may be different from place to place. Go on to the next slide. So let me say a few words about volunteer transportation. One of the key issues that keeps communities from considering it is liability risk. I will say that with the National Center on Senior Transportation on our website, which is provided on the materials outside, you can find out, we did a series of webinars on volunteer transportation, and liability is one of the issues that we addressed. There's lots of ways to address the liability issue. But basic decisions need to be made about who you're going to serve with the volunteer driver program. You can't really kind of open doors and open the floodgates. What do you have in place? What are your assets now? And how can a volunteer driver program meet those needs? Decisions about who drives the vehicles, whether older adults are your volunteer drivers, those can work. Those have been very successful. But again, you need a succession of volunteers because you need to know that your program is going to remain viable and in place over time. Lots of examples of the ways in which volunteers are used. They're not just used as drivers. They may be used as passenger assistants for people who need more than a ride in a car. They may need an arm to help them get out of the house. They may need someone to be with them at their destination, such as a doctor's office, or to help carry grocery bags. So you really need to think fully about the different ways in which volunteers can be an asset. And again, older adults can be assets in these programs. They can be vital parts of both delivering services as well as receiving them. Next slide. Mobility management. And I really think this is the centerpiece of what I want to say. If you want to think about increasing transportation options in your community, then the thing is that you need to, one, be able to provide that one-on-one, person-centered assistance, recognizing that people's mobility needs are as varied as people themselves. So you do need to have someone who can actually walk that person through. What are the variety of options available in the community? Who can provide this particular need as opposed to that particular need? We know from focus groups that have been held in various communities in the country that older people, if somebody explains to them the options, most older people are fine at that point. They can just go ahead and make their decisions. Others may need a little bit more hand-holding and assistance. The other really enormous benefit of mobility management is that it can help you identify where there are gaps in your community, where there are no transportation options to meet the need. Next slide, I'm going to go very quickly. These are just good examples. I'll be glad to talk with you about examples of communities that have been successful with mobility management as well as with volunteer programs. Next slide. And coordination, including transit in the conversation, including your human services agencies, bringing folks together to talk about this because this is not one discipline. Next slide. Funding for transportation is very complicated. I'll be glad to talk with you about this if you have questions about it. I really don't have time to go into it now. And that's it. Thank you very much.
Okay, Virginia gave us kind of a national perspective. She had the top three there and what folks should be considering.